Hello, my good people. Today, welcome to my health talk show. Today, my name is Dominic, and I welcome you as we keep on educating each other. So, basically, today we want to talk about one of the conditions that basically affect women. Very much it can also affect men, but it's not always a problem in men, but it's a big problem when it comes to women, especially in pregnancy. We want to talk about pregnancy complications due to Rhesus factor incompatibility. I repeat again, we shall talk about pregnancy complications due to what we call Rhesus factor incompatibility. So, I know people may wonder what we mean by Rhesus factor, although many people do understand when we talk about Rhesus factor. We do have what we call blood grouping. In the blood group, we do have what we call a Rhesus factor. So I will explain what a Rhesus factor is, and when we talk about a negative Rhesus factor, how it affects pregnancy, what complications it can cause in pregnancy, and how it can be managed. So basically, if you are a pregnant woman who have a Rhesus negative factor, you need to hear this because this one is going to be very much help to you. So when you are pregnant and you do have a Rhesus negative in your blood group, it may put you into a risk of, or rather into a risk of having different complications which will be associated with this kind of incompatibility. Some of the common risk factors, or rather complications which may come out as a result of Rhesus incompatibility, it's the likes of bleeding during pregnancy. You may have miscarriages. You may have what called hemolytic disease of the newborn. You may have another serious condition called connectress, which is basically brain damage of the child due to high levels of what we call bilirubin. So you can also have another condition called hydropis fetalis. This is where there is fluid build up in the rather swelling of the baby, and there is a lot of fluid which builds up. You may also have problems with mental functions, hearing, speech, and seizures. So those are some of the complications that may come as a result of Rhesus incompatibility. So as I had said earlier, first of all, we need to understand what is a Rhesus factor. Before we talk about incompatibility and the negative Rhesus, we need to understand basically what do we mean by a Rhesus factor. So a Rhesus factor basically is a certain type of protein that is found outside a blood cell. It's a type of a protein that is found in a blood cell. So people, it's either they have this type of cell or they don't. If you do have this type of cell, then you are Rhesus positive. If you don't have this type of cell, then you are Rhesus negative. Largest population are Rhesus positive, and the lesser population, that is around 15% of the general population, are Rhesus negative. So when you talk about Rhesus negative, it means you don't have this type of protein in your blood cell. And when you talk about Rhesus positive, it means you do have this type of cells in your blood. So this kind of distinctions mostly matters when you are Rhesus negative and your child is Rhesus positive. Let me explain this. If you are a woman, you are Rhesus negative, or rather you have blood Rhesus negative, let's say blood group O Rhesus negative, and you happen to carry a child in your uterus or in your womb who's Rhesus positive, this is when you will be able to get this kind of Rhesus incompatibility. But if you are Rhesus negative and you carry a child who's Rhesus negative as well, you may not have this kind of problem. And basically, how does it come that you have a Rhesus negative child in you, and yourself you are a Rhesus negative, and you carry a Rhesus positive child? This is how it comes. If your husband or your spouse is Rhesus positive and you are Rhesus negative, it's possible that your child may have a Rhesus positive blood. So for this case, you'll be a Rhesus negative and your child is likely to be Rhesus positive. So that is how the Rhesus incompatibility comes. So we have defined what is Rhesus factor. We need now to know what is Rhesus incompatibility. I think I've already mentioned about that. This is when a woman occurs, or rather when a woman has a Rhesus negative and carries a child who is Rhesus positive. So that is how what you call Rhesus incompatibility. In this case, with Rhesus incompatibility, the woman's immune system is likely to react to the Rhesus positive blood. With this Rhesus of incompatibility, the immune system reacts with the antibodies. And when these antibodies, or rather these reaction between the immune and the antibodies, it will make the immune system to attack against the baby, which in this case is mother's body views as a foreign body object. So when there is a mix-up of the Rhesus factor with these antibodies, it makes the immune system attack against the baby, and which in this case now the mother's body views this as a foreign body, and once the body rejects this as a foreign body, it's likely to cause what you call either bleeding. Some woman will end up having a miscarriage and some other conditions as we had mentioned above. So the incompatibility happens only if the father of the child is Rhesus positive. That is a point to note. If the father of the child is Rhesus negative, there is no likelihood of incompatibility to happen. But if the father of the child is Rhesus positive and the mother is Rhesus negative, then the incompatibility happens. There is something I want you to note, that the first pregnancy is not affected. If you happen to be having your first pregnancy, you may not be affected with this kind of incompatibility. This is the reason. The body has not been sensitized into producing what you call antibodies. So for this case, you will not be able to have this kind of incompatibility. But the second pregnancies and the pregnancy which may follow will also be affected. However, if you had an abortion or you had a miscarriage in your pregnancies, you still have the body has been now sensitized, or the body has been sensitized. For this case, you may end up now getting such kind of complications. So, having explained how Rhesus incompatibility happens, we now also need to check on why is this kind of information important? Why is Rhesus factor important? First of all, this protein does not affect your overall health. That's one thing you need to know. If it doesn't affect your health, because this is something that you were born with, it's in you, so if it doesn't affect your health at all. But it's important to know that if your Rhesus factor is negative and you are pregnant, it may have a problem. So before, it's always good that you get to know your blood grouping. That is why in your NC clinics, or when you're pregnant and you go to clinics, one of the things that is screened for is what you call blood grouping. So blood grouping is where also the Rhesus factor is also taken care of, so that you get to know whether you're Rhesus negative or you're Rhesus positive, so that you are able to avoid this kind of incompatibility. So who is at risk of having incompatibility? That is one of the things we want to look at. If a woman is Rhesus negative, is at risk of incompatibility when she becomes pregnant. Rhesus incompatibility happens only when the father of the child is Rhesus positive. We have said that already. that if your father or the father of the child is positive in terms of rhesus factor, then and you, as a woman, your rhesus negative, you're likely to be affected. So then we need to also to look at what causes rhesus incompatibility. I think we have already mentioned above how it happens, but now when we talk about the causes, we want to know how does it happen. This is how it happens. If there is a difference in blood type between a pregnant woman and her child, then rhesus incompatibility comes in. The child may be rhesus positive, that is from the father, and inherit that protein from the father. And they may also have rhesus negative as well when the child inherits that factor from the mother. So it's either way. If your child is rhesus positive and you're rhesus negative, you are likely to get this kind of a problem. So we want to look at now how does this case managed? How do we manage rhesus incompatibility? So basically, this is the very important information that I want you to listen or to look at it keenly. Treatment for rhesus incompatibility normally happens in this way. If you are pregnant and you are rhesus negative, that is, treatment of the child who is already affected depends on the severity of the condition. That is already if you have already given birth to a child who is already rhesus negative. But again, before that, if you know you are rhesus negative and you are pregnant, as we have said, the first pregnancy is not affected. But if you have had an abortion or a miscarriage for that case, then your body immune has already been sensitized. So for this case, this is what we normally advise you to do. During your pregnancy, at around 28 weeks, you need to get what you call anti-D. So anti-D is an injection basically that helps you to desensitize or to help you when you give birth, you don't have this kind of complications. Or during birth, before the 72 hours are done, you also need to get this kind of jab, that is anti-D injection. So for this case, you are able to prevent this kind of things. But if already you have given birth and the child has some few complications, the likes of hemolytic disease of the newborn, or the child is born with jaundice and all that, this is a child who may need to be put on what we call phototherapy. Others may need what we call immunoglobulins, may also be used to treat this kind of complication which they are so severe. Sometimes they can be a blood transfusion may also be needed. So on prevention, we also say that if you are rhesus negative and your baby is rhesus positive, you will have to be sensitized, or rather sensitized by being given anti-D immunoglobulin within 72 hours of birth. And you also are advised to get another jab during your pregnancy after 28 weeks and 34 weeks of gestation, that is to women in their first pregnancy. So with this, you are able to prevent this kind of incompatibility. So I think towards this end, I say thank you for watching and thank you for listening to this. We may continue giving each other information on different conditions that affect women during a pregnancy. On my next topic, I may need to talk much more about some of the complications during pregnancy, or complications during delivery, or complications even after delivery that affect women. Thank you for watching and thank you for taking your time. As I finish up, I say kindly continue subscribing to my YouTube channel by the name of Dominic, and also continue following me on my Facebook page by the same name, as we continue educating each other. Thank you, and may God bless you.